We are in public session and it will interfere with the recording equipment. A number of items I'd just like to raise under Chairperson's business. Firstly, the Minister's statement yesterday on scheduled care at emergency departments. It's on page 34 of your tabled papers. Obviously, the RQIA had published its review of unscheduled care in Belfast Trust and the regional wider context. The Department in its statement is indicating that it has accepted all of RQIA's recommendations and has now set up a task force under the direction of the Chief Medical Officer and the Chief Nursing Officer. The review of serious adverse incidents relating to emergency departments over the last 5 years has also been published. It's found that there were 13 deaths of patients where some element of delay contributed to their death, obviously of concern to us all. Suggesting, firstly, that the committee takes evidence from the Chief Medical Officer and the Chief Nursing Officer regarding the actions undertaken by the task force, how it will operate, its timetable for bringing measures and improvements about, and its terms of reference. The Minister has also today sent the committee information regarding the serious adverse incidents look-back exercise, as it's called. The Board has looked at the SAIs relating to emergency departments over the last 5 years. The main findings are that there were 83 serious adverse incidents in emergency departments over the last 5 years. There were 22 cases where the patient or the family were not advised that they were subject to an SAI. The Board and the Public Health Agency are currently drafting guidance for the Trust on how they engage with parents and families during the SAI process. And there were 13 cases, as I stated, where a patient died in an emergency department where the delay in their care has occurred, and therefore the delay may have contributed to their death. Obviously, members of great concern to us all, and I think it brings up a number of issues for the committee. Firstly, I suppose the announcement of a regional task force may somehow be suggesting that the current governance arrangements in terms of the Health Board holding to account or performance managing the trusts isn't working effectively. So I would suggest that there are issues there in relation to the governance within health. Is the establishment of this regional task force now suggesting simply that the Health Board haven't effectively been performance management in terms of the trusts? And I also think that we have had an A&E improvement group set up in 2012 under Mary Hines. Is this what recommendations ever came from that process? I know specifically that process was looking towards the Northern Trust, but there was a wider context to that, and it seems to be that we have simply almost raised the profile of this new task force, and I think there are serious implications for the delivery of health, and obviously, and particularly for these cases and these families who either have not been informed of an investigation around their loved one or now are only coming to terms with it. And it seems to be that it is a lot of the same. And I think that there's an urgency to a clear eye to this process. I think there's an urgency to getting a sense of what the terms of reference will be for this group, and when, in effect, they will bring into play recommendations that will actually deal with the recording and reporting of these serious adverse incidents. Farrell.
Chair, thanks very much indeed. I think there are a number of issues. I mean, the regional task force one suggests to me that they're going to start taking a look at this regionally, and we've been saying for a long time that some of the elements of TYC which shut hospitals around the region have led to pressures on accident emergency services at central and bigger hospitals, and so I hope that some work will be done in that regard around that. On the SAAs, I mean, I think there are a number of areas which we should be individually and collectively shocked at. The fact that delays in hospital led to deaths. They're saying that 22 families were not informed. They know that for a fact, but they're also admitting that more may also have not been informed. And they continually describe to us that the SAA process is about learning. But I think we have to ask a serious question here, given that families were not told about this. Is there still a culture of cover-up in the health service? And given that over the last 5 years, families were not told, then I think that has to be a major source of concern for the committee. Sir Liam Donaldson is going to be investigating some of this stuff, but as I understand it, his process will be at a downstream, if you like, at a later stage in the process. He will be taking evidence about how the trusts viewed their SAA process and working from there. I'm suggesting if that's where he starts, his inquiry is flawed from the start. There needs to be a fundamental review of the SAA process so that we, as a community and as individuals, and behind every one of those SAAs is an individual story, an individual person with a family who've had a loss, and for them not to know that there were circumstances out with their own condition that could have led to that death, I think is a disgrace. We need to be asking as a committee fundamental questions about the SAA process and asking, is Liam Donaldson starting in the right place, and will his inquiry result in anything at all of value if he doesn't get right back to the basics?
Kieran?
Yeah, Chair, I mean, I'd agree with what has been said already. I mean, the report the Minister gave to the Assembly the other day was shocking in itself, and certainly these 83 cases are, as Fergus says, they're human beings and families is all tied up in this, and there's something serious wrong. And I'm just wondering if, whilst we all acknowledge the extremely hard work of the frontline services in our hospitals, are they being starved of funding, perhaps, to enable them to do their job properly? I just don't know where we'll go from here. And I've got to say, if it wasn't for our local press, a lot of this stuff would still be covered and in below the carpet. And I think we want, whilst there is, the Minister will criticise the press at times for divulging. I think we owe a lot to the press and the journalists for picking these things up and alerting us to the seriousness of it. I'm just wondering where we go from here, because I asked the Minister yesterday on the back of that for accountability, and he didn't answer. We just go on from crisis to crisis to crisis, and nobody seems to be accountable for any of these serious incidents. I don't know, we may be in the last chance to learn, really. I mean, everything that crops up, I'm sure the Minister must be totally embarrassed when he has to come to the Assembly almost every week. And what does he do? Announce another group set up to examine this, that and the other? I've lost track of how many groups has been set up. So, I mean, we, as a committee, I think we must hope that we're coming to the end of the saga that has been the crisis in the health service.
Okay, Annette, Gordon.
Thanks, Chair. Yeah, I think we do welcome this report. I think it does, unfortunately, highlight that there are a number of issues that need to be addressed seriously. I think at the end of the day, the responsibility, a lot of it lies with the senior management within the Trust, and it's their job to get on and manage the business on a day-to-day rota. And we've seen ourselves when we went to the Royal, it is an extremely busy place. It is a consultant-led facility, I think, which shows that there's a lot of expertise there, and it's one of the reasons why there are so many people coming through the door. I think that needs to be remembered, that it's a hugely successful place as well, and that people go in there and come out, the majority of people come out satisfied, and because of its success, people go to the Royal Victoria Hospital, to the A&E unit, because it is consultancy-led and that there are huge resources going into it. But I do recognise the need for senior management to take a grip of what is going on within the organisation. And we see the emergency, the serious adverse incidents here, the report that has gone before us for over a 5-year period. There's been 83 incidents. And to me, there's a lot of inconsistencies of how they've managed those. And that's wrong. That's a failure within their processes, within their procedures, and it reflects poor management. And any system that's in place should show consistency. And if there's inconsistency, that should be highlighted through the senior management. It's their responsibility to address those issues, take corrective actions, and put in place the actions to stop recurrence. What has happened? There's weaknesses. Those weaknesses are not being identified, and are not being actioned, and are not being closed out. And that, I think, is a major problem within the service. And I think that's where a lot of the responsibility lies, is with the senior management within the Royal, and it needs to be addressed.
Okay, can I, in response to that, and thank members for their comments, but I think there's an urgency to this committee reflecting the view, because these issues have been identified over a period of time. The difficulty has been that there hasn't been any redress for those issues, resulting in what we see in front of us today: 13 deaths, which may have occurred as a result of delays in waiting times. So I think we need to reflect back to the Minister and the Department that this is cause for concern for the committee, and that there are fundamental questions that need to be asked around this. I think this committee needs to get a sense of the questions that we've raised today in relation to the role of the HSCB board. Is this a different structure that's put in place? Will the review, what will the terms of reference of the review be, and some of the comments around the role of Liam Donaldson in particular in taking this forward? We need to get clarity, and we need to get a sense that this will be action driven as well, that we won't simply be sitting with a process that was identified in 2012, which is ultimately affecting patient safety and indeed life and death. So thank you for that.
Just one additional comment. I know it was raised around the Attorney General's remarks, and I asked the Justice Minister about this in the House yesterday, and he doesn't necessarily feel it would be within the competency of the Legal Aid and Coroner's Courts Bill, but there may be some assessment to be done around how we would get an external eye, if that would be beneficial in terms of the SAI process and learning, so that it doesn't exist solely within hospitals and the healthcare system. There is some external eye, as I say, that keeps an accountability mechanism on it.
Okay, and I think we can.
Maybe it's separate.
But we can possibly tease that out when we're looking exactly at the robust nature of the terms of reference of what he's just set up, Roy.
The summary in tab 1 highlights that there were 48 of the adverse incidents were involved a patient's death, and we were advised that in 13 of those cases delay was at least a factor, or a potential contributory factor to death, and that we're specifically advised in each of those cases the coroner was advised. What I would like reassurance is that in all 48 cases, which involved the death, that the coroner was advised, because where there is a serious adverse incident, you would hope that there would be learning within the establishment and the trust. But where there's a death, you want to be sure, in particular, that there is that degree of independence on the coroner's involvement to satisfy himself that everything is transparent and that lessons have been learned.
I think there was a crucial question to be asked about the first sentence in that third paragraph, and it says the exercise has shown that requirements to report to the coroner have been complied with. The crucial question is, were they complied with at the time?
Timely basis. Yeah.
I mean, have they just been complied with now, ahead of this report, and it all tidied up? or were they complied with at the time. It might be interesting too to find out specifically what action has been taken in terms of that the Minister's description, this is not acceptable. And it continues, it says, outlining the requirement for engagement with patients' families where appropriate at each step of the SIA process. How big an opening is that for them not to engage? So there are a number of issues here that the Department Minister has raised in his own response that I think we need to get answers to.
Thank you, Sharon. There's a clarification. Okay, willing to do that. Okay, members, thank you for those comments. Moving on under Chairperson's business, a few other items. Firstly, obviously the Assembly's due to break for summer recess on the 4th of July, and it has been custom and practice for the committee to delegate authority to the Chairperson and Deputy Chairperson to submit views on freedom of information requests on behalf of the committee. So at the first available meeting after the recess, the committee would be advised of any such requests, the views expressed by the Chair or Deputy Chairperson, and the response issued by the Freedom of Information Unit for information. Okay. Also, the advising members at the Samaritans have requested to attend the next stakeholder event, so just seeking members' agreement to invite them. Thank you. Item 5 is the draft minutes of... Oh, yes, I did. Sorry, under Chair's business, I did have another item. Obviously, the June monitoring round hasn't been resolved or decided on. I think it would be appropriate that we would seek assurance from the Department that we're kept informed as those decisions are taken, and also with a view to how they'll impact on the wider 14-15 departmental budget going forward. Just bearing in mind that we are going into recess, but I think it would be appropriate that we would relay that back to the Department so that we continue that conversation over the recess. Members, item 5 is the draft minutes from the meeting on Wednesday the 25th of June, page 23. Are members content with the minutes? Great. Okay. Item 6 is the evidence session on the proposed bill to amend the Health and Personal Social Services Act 2001. There's a briefing paper from the Department at page 28. Okay, you're very welcome. We have Christine Smith, Director of the Office of Social Services in the Department, Lorraine Conlon, Office of Social Services, Governance and Planning, and Patricia Higgins, Director of Regulation and Standards, Northern Ireland Social Care Council. So you're very welcome. It's a 10-minute presentation from yourselves, and then we'll open it up to questions or comments from members.
Okay, thank you, Chair. You've already introduced my two colleagues, Lorraine and Patricia, and just to say, Lorraine is the head of the Bill team, and Patricia is also a member of that Bill team. We very much welcome the opportunity to update you on the Department's proposals for amendments to the Health and Personal Social Services Act 2001. And you will have received a briefing paper which outlines the background, the policy objectives of all of the proposed amendments and key areas of development. I don't intend to rehearse the detail in the briefing paper, but rather will highlight key points in respect of the main areas for amendment, and then we'd be happy to take any questions which you may have. You will all be aware that the Council was established by the 2001 Act and is responsible for the regulation of the social work and social care workforces in Northern Ireland and for the regulation of professional training courses for social workers. It's important that the model of regulation used by the Council is fit for purpose, is efficient and cost-effective, and one that commands the confidence of the workforce and the public. The current system has been in place since 2003, and whilst it has been robust, it has not kept pace with developments in regulatory practice and is no longer up to date. The intention is to build upon the strengths of the existing system and at the same time bring it into line with best practice, into line with other workforce regulators, notably healthcare regulators, and into line with broader developments in how education and training is delivered in the 21st century. The proposed amendments to the 2001 Act aim to do two things. Firstly, to modernise the Council's model of regulation, and secondly, to extend the Council's powers to formally recognise social workers' learning achievements. In relation to the modernisation of the Council's model of regulation, the current model is based on a determination of misconduct. The current range of sanctions available to the Council to enable it to take appropriate action against registrants include admonishments, suspension from the register, and the most serious of all sanctions, removal from the register. Compared to other healthcare regulators, this range of sanctions is limited, and it restricts the Council's ability to respond flexibly and proportionately to individual cases, particularly where there are issues regarding health or competence. In some cases, this may lead to individuals being treated more harshly or at times more lightly than other professions for matters of misconduct, because the Council has fewer options for the disposal of cases. The General Medical Council, the Nursing and Midwifery Council and the Health and Care Professions Council all have a broader range of sanctions. And more recently, the Pharmaceutical Society of Northern Ireland's legislation was amended to provide for a wider range of powers, similar to these regulators. So the proposed amendments will bring the Council's model of regulation into line with the practice of other regulators and what is currently considered to be best practice. And the broader range of sanctions will include undertakings and conditions in order to the existing sanctions of the admonishment, suspension and removal. The second main area of proposed amendments relates to extending the Council's powers to formally recognise social workers' learning achievements. Registration with the Council requires that registrants maintain and improve their knowledge and skills in order to be accountable for the quality and safety of their work with vulnerable people. The proposed amendments will extend the Council's powers so that it can recognise learning and development achieved by social workers in respect of improving their knowledge and skills through a range of approaches to education and training. Currently, the legislation allows the Council to only award certificates to social workers for the successful completion of formal training courses. The proposed amendments will enable the Council to award certificates to recognise learning achieved through alternative approaches such as in-service training provided by employers, e-learning, distance learning and learning through experience and reflection. Formal recognition of learning by the Council will provide additional assurance to employers and to the public in respect of social workers maintaining and improving their skills and knowledge throughout their careers. All of the proposed amendments have been subject to public consultation in 2012. Consultees included registrants, employers, trade unions, key stakeholders from the statutory and voluntary sectors, as well as the professional body and professional organisations and universities. And the results of the consultation indicated support for implementing the proposed amendments. So, in summary, the proposed amendments are intended firstly to modernise the model of regulation and ensure it is fit for purpose, reflects best practice and is efficient and cost effective. And secondly, the proposals to extend the powers of the Council to award certificates in recognition of learning achieved by social workers through a range of methods are in response to the changes and advances in the way people learn and, in particular, the growing use of technology in supporting learning and development. Formal recognition of learning achievement contributes to public confidence in the competence of staff and to improving standards. Chair, I'd like to thank you for the opportunity to brief you and the members here today. I hope it's been useful and we'll be happy to take any questions, and we look forward to working with you to take this work forward.
Okay, thank you, Christine, for that. Just I suppose, in clarification, the proposal is around the two aspects, the modernisation and the recognising, I suppose, social workers' learning achievements. Yes. In terms of the modernisation, I mean, is it effectively about bringing in a broader range of sanctions? Is that effectively what we're
It
saying?
is. It's bringing in a broader range of sanctions, and there are some other minor amendments to just tidy up some of the legislation. For example, putting a duty on people to cooperate with the Council in the provision of information for investigation of conduct cases. But it is the broader range of sanctions is the key bit to this amendment.
Okay. And then, you see, in relation, you mentioned in terms of the first modernisation aspect of it, about best practice, would that reflect on issues? For example, there's a huge debate currently within social work around code of conduct.
Yes.
Would that reflect?
Absolutely. I mean, I'm not sure whether you're aware or not, but the Northern Ireland Social Care Council have recently carried out a review of their codes of practice for social care workers. They were over 12 years old, and they are currently updating those to reflect the modern day practice and the differences between social workers and social care workers.
Yeah.
And that work is ongoing. Patricia, I don't know if you'd like to say anything.
No, I don't think I need to add anything to what you've just said.
Okay.
Okay.
Okay. So it does, but it does.
It does.
Yes, it does.
Okay.
It's part of a range of improvements.
Improvement measures.
Thank you. Gordon had indicated.
Thanks, Chair. Thanks very much, ladies, for coming in today. Just on the alternative training, how are you going to regulate this training and ensure that it is up to the required standard before you give it the approval?
If I could just say, the Council will be setting standards in terms of the learning outcomes to be achieved, against which they will assess whether an award can be made, and there will be some regulation of the training, but it will be lighter touch than the formal regulation. Patricia, would you like to?
Yes, we will have standards to gauge the training in terms of what we would recognise as good quality training. But I think at the minute, because we're only really able to provide for courses, we want to be able to acknowledge the fact that social workers do quite a wide range of training and learning, which is of a high quality, and we would like to be able to acknowledge that.
Do you have a system of validation, or you intend to have a
Yes,
system?
we're developing a system of validation, beyond the system of validation which we have now for courses which we approve.
Yeah, and I appreciate how training has changed. On the personal development, then, will there be a personal development plan for each of the staff to carry through?
Yes, as part of registration, we do require staff to have personal development plans which identify the training that they're required to do. We also carry out audits twice a year of those people who are renewing their registration, and as part of that we ask to see the personal development plan.
So it's a requirement to meet that plan?
I think it's a registration requirement
Yes.
that those registered with the Council will undertake ongoing training and development, and therefore you would expect to see that reflected in their plan. So it's a requirement to undertake training and development. Yeah.
And obviously on an ongoing basis to
To keep the knowledge and skills
keep
up
the
to
knowledge
date.
and skills up to
Absolutely.
date. Yeah,
That's
yeah, that's
absolutely
great.
right.
Just on the other issue where you're modernising the model of regulation, and do you see a real need for that? And why do you see a real need for it?
I think, and I will let Patricia come in, but I think the experience has been, in terms of running conduct cases for the past number of years, that the options at present open to dispose of those cases, it's a very blunt instrument, because essentially you're either on or you're off the register. You might get an admonishment, but you cannot set a condition for somebody, for example, who perhaps it's a competence issue and they need to do more training, or there may be a health issue that you can't actually dispose of without either removing them from the register totally or suspending them from a period of time, but with no corrective action being able to be taken. Would you like to
That's
expand on
absolutely
that?
right. The modernisation and the increase in sanctions will actually make our regulation system more robust, because it is difficult for us, as Christine has said, if you're either on or off the register. So if you are identifying that someone actually needs to undergo additional training in order to improve their practice and address the issues or the matters that are before the Council, we are not able to do that, whereas having conditions will allow us to do that.
It means they're still on the register, but it is conditional.
It would mean they're still on the register, but it is conditional. So you can set conditions. You can set conditions in relation to practice or set conditions in relation to training. And Christine mentioned health as well. And it may well be that if someone is presenting with a particular health issue that requires attention, that you may be able to restrict practice and therefore put conditions on in relation to that. So these are options that other regulators have that unfortunately we don't.
And I think as well, if somebody is suspended off the register, you are able to put a condition on that while they are suspended, that they will undertake a piece of training or something else, which then will allow them to come back on to the register, which means corrective action has been taken, and that can be monitored, that has been done, and that's not open to the council at the minute, so it is limited.
So there are benefits both ways then, for the employee,
Absolutely.
for the employer as well.
Yes, that's absolutely right.
Okay, thanks very much, ladies.
Okay.
Thanks, Chair.
Fergal?
Thanks very much. Obviously, the first consultation began around June 2012, and I assume conversations had taken place some significantly before that. Why has it taken so long to get to this point?
Partly it has taken so long because we had a change of personnel in the middle of bringing forward the proposals for the legislation, and the period of time it took to replace a member of staff and to get the bill team re-established has actually delayed the work.
I asked the question because you've pointed out that some people will have been subjected then to a more blunt instrument than otherwise you propose they would be subjected to. How many people will have been subjected to that blunt instrument in the meantime while there's been a delay in getting the legislation through?
I don't think I could give you the numbers between the delay in the legislation and now, although maybe, I don't know whether you can, but we could give you the statistics of the number of people in the last year in terms of the number of complaints that we've received, the council has received in the last year.
In the last year, we have received 258 complaints in total in relation. 258.
258.
In relation to social workers and social care workers, the totality of the register. Now, not all of those complaints will end up in a hearing, obviously, as we investigate all of that. But I'm sorry, I wouldn't have the statistics to be able to answer your exact question.
You can see the point that I'm making, that there are clearly people now who've been taken off the register, that had this process been speeded up and done in a timely manner, they wouldn't have had to be subjected to that. Could we find out the numbers that are involved?
We could find out the number of people who have been removed from the register during the period of the delay.
Consistent with other jurisdictions.
Yes.
So in other words, technically speaking, they shouldn't have been taken off the register. Potentially.
Well, not necessarily. Potentially. Potentially.
But it would be interesting. It would be interesting to know that number. And can those cases be revisited in any sense?
I mean, I think. I suppose maybe I need to just say that obviously every case is dealt with on its own merits, and the evidence are presented to the Independent Conduct Committee, and they will make a determination as to the best course of action based on indicative sanctions guidance which we provide. So they will have made a determination as to whether the matter was severe enough for someone to be removed from the register, suspended from the register, or admonished, which means they remain on the register. So, the range of sanctions that were available to the committee, they will have determined, based on the evidence and information in front of them, which was the appropriate sanction to apply.
Within the range that you're offered.
Yes.
And is there anything that can be done in terms of the legislation that can be retrospective to revisit anything? Is that maybe off the wall?
We would have to explore that. That hasn't been looked at. Can I come back to the point about the removal? Because I think it's important to put in context that removal from the register is a very serious step, because obviously people cannot continue their career in social care or social work. So it is the most extreme sanction. And since the NISC have been hearing conduct cases from November 2007, that the number of people who have been removed from the register is 38 in total. So there have been 7 social workers removed from the register between November 2007 and June 2014, and 31 social care workers. So it's a very small proportion of the number of complaints and indeed of the total number of people registered, but we will get the statistics of the number that have been removed in the period of the delay in bringing forward the legislation.
And if I could maybe mention as well, it's kind of in relation to the number or the revised sanctions and the new sanctions. Part of the reason why we're very keen to get the legislation underway now is it's actually to bring around efficiencies in the NISC system, thereby by dealing with the kind of more minor cases and identifying those and getting those dealt with kind of more quickly. It will allow NISC then to be more effective and efficient how it runs its business. So it's more that is kind of the incentive for taking this forward, as opposed to, and I take your point, Virgil, around the kind of more serious cases, because I mean, obviously if it's kind of a case of a very serious nature, that isn't something which is dealt with lightly. That will be investigated, explored, because, as Christine has pointed out, the very serious nature of it. So that kind of case would not be done within a very short time scale.
I know, I take on board what you're saying, but particularly that some of the options might include then further training, etc.,
Yes,
etc.
yes,
And to lose
exactly,
somebody
yes.
who's trained up
Yes,
and maybe
yes.
benefiting from
Yes.
the other thing. And just one
Take
final
your
thing,
point.
if I may, Chair, just you know, is there another process that when you find yourself a man down, that you could reach to another resource to try and get these things? Because this sounds to me like a speedy, it got broad support on both consultations, should otherwise have gone through at least a year or more ago, and yet we're sitting 2.5
We did
years
explore options for getting other expertise in that could actually lead a bill team, but within the group that I work in, there were commitments to other pieces of legislation, including the mental capacity, the Adoption and Children's Bill, and we were unable to free up the expertise that we needed, and we actually had to recruit from another department to help us take it forward. So.
Okay, thank you. Thank you, Chair.
Okay, thank you. Kieran?
Yeah, thanks, Chair. Thanks very much for your presentation. Was there any reason why these measures were not considered in relation to the recently passed Health and Social Care Bill? Was there any reason why it, would it not have been more efficient? Would it not have been better if they had been included in that recently passed bill?
Is that the
Social Health and Social Care Bill that was recently passed?
right? Well, we certainly didn't consider bringing it forward with another piece of legislation because it's amendments to the primary legislation of the 2001 Act, and we needed to bring it forward within that. And I'm not quite sure what the timescale of the other bill was, whether we could have.
I just thought it might have been
Yes,
but yeah, sorry. And you mentioned the small numbers of people removed from the register.
Yes.
Now, whilst they may be small, they obviously have committed a really
Absolutely.
serious. Should those people have been in that particular job in the first place, in relation to they're dealing with very vulnerable
Absolutely.
people?
I mean, I think that's a very valid question, and certainly the registration with the council it should be looking at people's suitability to work in the sector, and criminal checks and the fitness of character are all looked at that point. But we also depend on employers and their recruitment processes, that those are rigorous and proper references are taken up, criminal access checks are made, and that people are supported in their jobs, because we would prefer to prevent unsuitable people coming into the workforce rather than having to remove them subsequently when they have done something that is very serious. Yeah.
Okay. And how important is the read across here with transforming your care? If we are asking for more activities to be conducted with the community, is there an inescapable requirement to tighten up the regulation in relation to transforming your care? That's the journey we're all on at this moment in time.
Absolutely. I mean, we see a very strong interface between the regulation of the social care workforce and transforming your care, that will support transforming your care, because if the aim is to have more people being cared for in their own homes with staff going in, we need to make sure that those staff are suitable to be going into people's own homes and providing an appropriate standard and quality of care, and that they're safe. And we believe that registration is one part of assuring the quality and safety of those workers, along, as I say, with employers' responsibilities and the service regulator as well.
Right. Okay. Thanks, Chair. Thank you very much.
Kieran. Roy?
One of the points that you've mentioned is that you're going to authorise certification of training or recognised training that employers provide for employees.
Yes.
Can you elaborate on what assessment there will be of learning of in-house courses? If there will be any independent validation, just to make sure that it's not just a paper exercise that people have completed certain courses?
I mean, I think that's very, very important, that it's not just a paper exercise and a tick box exercise. Employers invest a lot of money in staff training currently, and so there's training on joint protocol for the investigation of child abuse, investigations into safeguarding, and it's very highly developed training and well run and of a high quality. And I think where the Council will come in is that it will set standards to recognise training and also standards regarding the expected learning outcomes, and individuals will have to demonstrate how they have taken that learning and applied it in practice. So there will be a process put in place,
yes,
that it will not just be I've attended a course and therefore I'm going to get an award. There will have to be a process that the learning has been learnt and it has been applied in practice, and that you are demonstrating the knowledge and skills required to do that.
Yes, that's absolutely right. In terms of our ability to recognise learning, what we will be looking at is outcome and impact. So not just what did you learn, but how has that impacted on your practice? How has that improved your practice with service users? And we very clearly be looking for that before we would recognise the learning and training that's been undertaken.
Thank you very much.
Okay, thank you. Okay, folks, just by way of conclusion, because I don't have any other speakers now. I'm looking at this, it's talking in terms of now subject to executive agreement, that the timetable would be introduced into the Assembly by November,
In November
2014.
year.
That's
Sure,
correct.
yes, yes.
Okay.
And,
Okay.
and hope to anticipate then royal assent by next May, June.
Okay. Okay. Well, listen. Can I thank you for your time? That's been informative. Thank you. Thank you very much.
Thank you.
Members, item 7 is the proposed statutory rule, the Health and Personal Social Services, prescription of drugs, etc. amendment regulations. It's on page 38. The purpose of the proposed statutory rule is to remove restrictions on a number of drugs under General Medical Services contract. Are members content for the Department to proceed with the statutory rule? Thank you. Item 8 is the Forward Work Programme. Informing members that there will be a planning meeting on the 10th of September at 2 p.m, followed by a short committee meeting, if members would put that in their diary.
Just a wind up and going.
Item 9 is matters arising. Asking members to note items 9.1 and 9.2 on pages 44 to 46. Item 9.3 on 47 is a response from the Minister providing the draft recommendations from the College of Emergency Medicine on emergency care. Final recommendations have yet to be received. I have to say it's slightly strange given the fact that we've come out of 2 emergency summits around this issue. I'm suggesting that we write back to the Department for the timetable for the receipt of the final recommendations and the sign-off on the action plan. One of the issues in the first emergency summit would be that there would be an action plan agreed and signed off, and it's ironic that it's not in place yet, but I'm seeking that endorsement that we do that. Asking members to note item 9.4 on page 55. Page 57 is a response from the Minister about issues raised in the AGNI report on denial of continuing health care. Are members content that we note and copy this response to AGNI who had raised these issues?
Great, yeah.
Thank you. 9.6 and 9.7 on pages 60 and 63 are to note. Item 9.8 on page 69 is a minor amendment, SR 2014-158, which was approved by the committee at its meeting on the 18th of June 2014. Are members content to note? And items 9.9 and 9.10 on 38 to 40, I'm asking members to note. These are on the tabled papers. Item 10 is correspondence. Again, asking members to note 10.1 to 10.4, which is on pages 72 to 108. Page 110 is a letter from the All-Party Group on Epilepsy, seeking a meeting with the committee for representatives of those living and working with epilepsy. Are members content to invite the group to a stakeholder event? Okay. Page 111, I'm asking members to note. Page 112 is a letter from the British Society of Dental Hygiene and Therapy about the future of the School of Dental Hygiene in Belfast. I'm asking members if we're content to write to the department about this matter. Page 113 is correspondence asking the committee to sponsor the launch of a report on alcohol treatment services. Are members content? Thank you. Page 114 is correspondence from a Mrs O'Hagan regarding some research she's carried out on cancer and complementary therapies. She's requested to present her research to the committee and suggesting it might be more useful to forward the information to the department and seek their views on the issues that are raised. Thank you. Page 118 is correspondence about a personal case. Are members content to refer the correspondent to her constituency representatives for support? 10.11 and 10.12 on pages 42 to 54 of the table papers I'm asking you to note. 10.13 on page 55 of the table papers is a letter from the Human Rights Commission to the Minister seeking an update on the termination of pregnancy guidance. I'm suggesting that the committee also writes to the department to seek an update on the timetable for publishing the guidance and clarification on whether there will be further public consultation on it or further engagement with the committee before publication. The members agreed that we seek that?
Chair, could I just as
Sure.
one thing? I couldn't see it quickly enough on my computer, but it was just around that the hygiene inquiry. I think this is something that is of concern to the committee. Good dental hygiene and training for young people can lead to a whole lot of benefits in terms of digestion, etc., etc., etc. And for there may be question marks now hanging over this school and the qualifications, and I think that would be a hugely retrograde step. This is about prevention. It's about healthiness. It's about young people, and we could be saving money in years to come if we put resource in now in terms of encouraging people to keep. We don't need to be filling teeth if we really look after them well. I regret that I've had to go through fillings all my life and that sort of thing. I would love, and yet my children, through good dental hygiene, don't have to, and I was at their age well filled, if you like, by that stage. So there is an onus, I think, on us to make sure that we do as much as we can. That's a small cost now, which will save us a fortune in years to come. I just think it's something we need to underscore.
Point well made, I think, and accepted.
What are we doing? Just remind us now.
We're writing to the department to
that's
see
it. Yes,
their response to this letter.
I think it's something we just keep an eye on as well. Though.
Right.
Thank you for that. Okay, page 57 of the tabled papers then, members, is correspondence from the All-Ireland Institute of Hospice and Palliative Care. They're seeking a meeting with the committee, seeking agreement to invite them to the next stakeholder event. Asking members to note 10.15 on page 58 of the tabled papers. I want to refer members to the correspondence from the department regarding a proposed statutory rule to amend the quorum of a safeguarding board to make changes to membership. It's on the tables in front of you, members. Just noting that this was received at 12:30 today. The department has carried out a very short consultation on these proposed changes. In fact, it was 2 weeks. And the letter's not clear about whether organisations actually supported or opposed the proposed changes. The letter just refers to the consultation. And I think, I'm sure members would agree that given the importance of the role of the Safeguarding Board, and particularly I think in the current inquiry into child sexual exploitation, I think that the way that the department has approached these proposed changes is not acceptable. And they intend actually to have this rule operational by the 24th of July. So in other words, they're working to a timetable which has really provided no opportunity for the committee scrutiny of changes to legislation. And I emphasise that these are changes to legislation that we're talking about. So I'm suggesting, members, with your approval, that we write back to the Department to express our disappointment at how the process has been handled and request that the Department defers from making the rule until the committee has had proper opportunity to scrutinise it and take evidence from officials and other interested stakeholders in early September. I really don't think that a 2-week turnaround and information being provided at 12:30 today is sufficient.
I noticed that they've copied it to the Northern Ireland Human Rights Commission. Is that their first sight of it too?
I'm not sure if it is or not.
Have we had any other consultation references at all?
Chair, the department wrote it was considered at the committee meeting on the 18th of June just to advise that they were going out for a 2-week consultation. But at that stage, they hadn't conducted the consultation, so have no information about the outcome of the consultation.
Yeah, and I think the issue in the letter today is the fact that it refers to the consultation, but it doesn't give us any indication of whether people were in favour or opposed to any such change. So I think it would be appropriate in the circumstances that we reflect that, and we do ask the Department to defer that until such times as we can properly scrutinise the process. Members agree with that? Thank you. Okay, members, item 11 is any other business. Do members have any other business? Okay. Item 12 is date, time and place of next meeting will be on Wednesday the 10th of September 2014, starting at 2 p.m. in the Senate Chamber Parliament Buildings. Thank you.